So today's webinar is about stigma and language. As some of you may know, NSPA are holding a campaign over the autumn and winter months, which we launched at World Suicide Prevention around World Suicide Prevention Day, which is really focused on exploring stigma and about how can we challenge stigma related to suicide. And that includes talking about a range of topics, but one of the things today that we thought was really important to talk about is language and how language impacts stigma. And this is really an opportunity for you to hear, particularly from David and Dennis, about their perspectives on that and some of the work and things that they do to help help challenge maybe some stigmatizing language, think about language that they find helpful or unhelpful. So that will be our main focus. I think what we will come on to do is I'm sure you're all really looking forward to hearing from David and Dennis. So what we're first going to do is going to have a bit of a conversation with David, and then we're going to come on to Dennis, and then do feel free to pop any questions for the Q&A out to audiences after that as well. So David, who's a lived experience influencer with NSPA, we've got a few questions for you, David, but before we come on to those questions, I wondered if you just wanted to briefly introduce yourself and tell everybody here a little bit about yourself.
Thank you, Jess. Good morning, everybody. It's great to see everybody here today and in such a high number as well. It's great. So I'm David Breakspear, National Suicide Prevention Alliance Lived Experience Influencer. I may cover some topics as I speak, so I'll just talk about kind of a few personal things. That I live down in Sevenoaks in Kent with my partner Kelly. We've got a dog, Betty, and a cat, Millie. And I'm really looking forward to today's webinar.
Thank you, David, and thank you for telling us a little bit. I always love hearing about people's cats as well, so thank you for that. So David, I wondered if you could tell us, from your perspective, what role does language play in stigma surrounding suicide?
Well, from my perspective, and I suppose a lot of people's perspectives that are here today, the words we use, particularly around mental health and suicide, can have a tremendous impact on how we view those who are struggling, and indeed how we view ourselves. And I think language has a way of shaping society's perceptions, and unfortunately, suicide has been long wrapped in stigma due to the way it's discussed. And I can speak about that from personal experience because I spent 4 decades in and out of the criminal justice system, caught in a cycle of crisis, crime, and mental health struggles. And during that time, I experienced how language, both from society and those around me, reinforced negative perceptions about who I was or what I was worth. I mean, we often hear phrases like committed suicide. And if you break that down, it's rooted in a historical context where suicide was considered a crime. And the word committed carries with it connotations of sin, criminality, and wrongdoing. And for someone who's struggling or has lost a loved one to suicide, and hearing that kind of language can feel like an indictment. It suggests blame, as if suicide is a choice made out of malice rather than a tragic outcome of pain and mental illness. I mean, when I was diagnosed with ADHD at 40, for me, it's like putting a piece of my life's puzzle in place. Until then, my struggles have been labelled in ways that didn't acknowledge the underlying issues. And that same thing happens with suicide. And I suppose when we frame it in a judgmental language, we're missing the opportunity to address the real factors at play: trauma, mental health issues, neurodiversity, or personal crisis. I think by shifting to language like "died by suicide," I think we're starting from a place of understanding rather than condemnation.
Thank you, David, and thank you for sharing a bit about your own personal experiences within that as well. I think it sounds like that's the historical context, especially around criminalisation, is and the way that stigma plays out there. It feels so important there for people to be aware of. And I wondered if you can, I mean, you started to touch on this already, but if you could tell us a little bit about how does language impact people who are affected by suicide? You know, what is the impact of that kind of language on people?
Well, again, I suppose I'd like to share again something personal because I think it speaks to the power of language. As I said, in my own life, before I found the support I needed, I really struggled with feeling misunderstood and judged. I was trapped, as I say, in the revolving doors of crisis and crime. And the words that are used to describe me, and of course other people that are also trapped in those revolving doors, and whether it be offender, disruptive, or failure, only made me feel further removed from help. I mean, I wasn't diagnosed, as I say, until later in life with ADHD. And by then, I'd built up so many layers of shame and self-doubt, which much of it was being reinforced by the language that was being used about me. And if we apply that same idea to suicide, for people affected by suicide, whether they've experienced suicidal thoughts or lost someone close to them, the impact of language is profound. If someone's already feeling isolated, hearing phrases like selfish or taking the easy way out, it only deepens that sense of isolation. It tells them that their pain isn't valid or they should be ashamed for feeling as they do. And in my role at the National Suicide Prevention Alliance and other organisations, I've had the privilege of speaking with people who've lost loved ones to suicide or who have survived attempts themselves. And their stories are heartbreaking. And there's always a common thread that the pain of loss or struggle is compounded by the hurtful words of others. I mean, imagine being in the depths of despair only to hear that your feelings are just for attention or that you need to snap out of it. That language just pushes people further and further into silence when what they need most is to feel seen and understood. But if we use compassionate language, words that acknowledge the depth of of a person's pain, or without placing blame, we create a space for healing. I mean, I know from my own life that when people approach me without judgment, it allowed me to start seeing my value again. And I think the same could be said for people affected by suicide.
Thank you, David. There's something really there around that, moving away from, you know, the shame, the impact that that can have on shame, and how much shame can add to suicidality in and of itself as well. And I really loved what you've just said there around that more, I guess, compassionate approach, and that's, you know, being with someone in that sense as well. Thank you. And what changes do you think we need to see in language to create a kinder society, thinking especially about what you're saying about that compassionate approach?
Well, look, first of all, we need to stop using language that criminalises or trivialises suicide. I mean, we need to move away from terms like committed suicide and instead say die by suicide. But it's not about being politically correct. It's about reflecting the truth. Suicide isn't a crime. It's often the result of deep pain, mental health challenges, neurodiversity like ADHD. Um, and in a way, that's why I struggled, because I didn't understand why I was feeling different. I think also the media, we also need to see a shift in how the media talks about suicide. When headlines, for argument's sake, sensationalise a person's death by focusing on the act itself, it just perpetuates the stigma and it makes it harder for others to come forward, I think. And instead of talking, we need to talk about the circumstances leading up to suicide, mental health, trauma, systemic issues, and focus on prevention and support. A society that leads with kindness would approach suicide as a health issue, not a moral failing. And in my experience as a listener for the Samaritans when I was in prison, I've seen how powerful it is when we choose words that recognise someone's humanity rather than reduce them to the worst moments. I mean, in prison, I watched as men who have been written off by society open up and start to heal simply because someone took the time to listen without judgment. And I think we can create that same shift in society just by changing how we speak about suicide and by seeing the person behind the pain.
Yeah, absolutely. Thank you. And David, I know, one of the things you've told us in conversation before is when you're quite active on social media and things like that, and often, will challenge stigmatizing language. And I wondered, what do you think? I mean, and some of the questions we've had in advance of this session from people attending have been, how can we challenge sensitively? How can we challenge positively? And I wondered, what do you think people, maybe people listening to this, could do to make a difference around
I
around
think
these
everyone,
messages?
I think everyone in society has a role to play in changing how we talk about suicide. It shouldn't just come down to people that have experience of suicidality, but it starts with awareness. Be mindful of the words you use, whether discussing suicide with a friend, as you say on social media, or even in your own thoughts. I mean, and if you hear someone using stigmatizing language, correct it gently. And it's not about policing people's words. It's about educating and raising awareness. Going back to my own experience, when I was released from prison for the final time in 2017, I made a conscious decision to use my lived experience to make a difference. And one of the ways that I do that is being mindful of how I talk about mental health and suicide. I've learned that language can either build bridges or erect walls. And I've seen how using compassionate language opens doors for others to share their experiences. It's about starting conversations as well. Start conversations about mental health and suicide without shame. I mean, ask open-ended questions like, how can I support you, rather than jumping to conclusions. But most importantly, listen. Really listen to people who are struggling. I think each of us can make a difference by choosing language that fosters understanding and compassion rather than using language that reinforces stigma. As I said earlier, language is a powerful tool, and it can either perpetuate stigma surrounding suicide or it can help break it down. And my own journey really has taught me that words matter. But it also taught me that each of us can change how we talk about mental health and suicide and people in prison and people in the criminal justice system. And I think by choosing, again, compassion over judgment, by speaking with kindness, and by making space for the stories of those who've been affected by suicide, which is one thing I'm grateful to the NSPA for, that they provide that platform, we can create a society that's kinder, has more understanding, and ultimately a place where fewer people feel alone in their struggles.
Thank you, David. There's something around, I think one of the things I'm hearing in that as well is around that kind of leading by example. So then the
Mm.
language, the language we use and people hearing that and opening up those
But
conversations.
again, Jess, what's something that is important is, I think, what we tell ourselves is
Mm.
just, if not more important than what we tell others.
Oh goodness, yeah.
I think the language, I mean, I went through years being labelled this, that, and the other, and I called myself this, that, and the other.
Yeah.
And it was only really when I started to become a better person in respect to the criminal justice system that I started to see myself in a better light. I started to see other people in a better light. I started to care for people more. I started to care about myself more.
Mm.
So the language that we talk to ourselves, or the language we use when we talk to ourselves, is extremely important.
Mm. That's really powerful, David. Thank you for saying that. It's actually making me think about some of my own experiences. So I, as you know, I have personal lived experience myself and need to do my role. And one of the things is for me to be working with lots of other people with lived experience. Over the years, I've really had to start being kinder to myself because it comes out if I'm being self-deprecating. People hear that and apply
Yeah,
that to themselves.
don't get me wrong. It's sometimes it's good to be self-deprecated because
Yeah,
he who laughs at himself has never has anything to run out of to laugh at.
yeah,
So yeah, I mean, you can be self, but then I suppose that comes down to reflection as well. Some of us do silly things some of the
yeah,
time. Some of us make big mistakes, like I did most of my life. But yeah, I think self-deprecating, it's like most things, isn't it? It's in moderation.
yeah. Yeah, absolutely. Absolutely. And it's a being kind to ourselves whilst being kind to other people as well, isn't it? I
It
can
is.
see, and I can see some points in the chat, David, which you might want to in a minute have a look through. Apologies, everybody in the chat. There's so many people on this session that I can't read out all of what's in here, but do have a look. And I think there is something that I'm hearing in some of the comments in my chat as well, is about some of it is around lack of understanding. And I guess having those open conversations can really help with that understanding as
You
well.
can't really claim someone's ignorant if they don't know.
Yeah.
And
Yeah.
that's why I mean, awareness is key. Because the easier we have the conversation, the easier the conversation becomes.
Yeah. Yeah. Yeah, absolutely. And I think there's something, maybe for people to think about here as well as some comments around, how important it is to challenge language, but how that can be difficult depending on the position that the person we're challenging is in and things like that. And I think that that's, all really important things for us to be thinking about.
Yeah, and I think it comes down to not whether I should or shouldn't, but how.
How?
How
Yeah.
do I do it? That's what it comes down to. How do I do it? I funny enough, only yesterday I challenged an online media company, Chronicle Live, for the use of the language that they used within a story about someone in prison that took their own life.
Mm.
Um, and funny enough, I sent them through the Samaritan's media guidelines.
Mm.
But again, it's I did it in a respectful way,
Mm.
and again mentioned the word awareness because you can't claim someone's ignorant if they don't know.
Yeah.
But if they do know, then obviously they are ignorant.
Thank you, David, and
Welcome.
thank you for your reflections and sharing so much about yourself as well and your own
Ah,
experience.
you're welcome. You're welcome. I think that's what makes a difference, doesn't it? It's if you like bringing those statistics to life,
Yeah, yeah, absolutely. We're
and
gonna
giving a voice to those that can't speak anymore.
yeah, yeah. I'm going to come on to Dennis in a second, but David, do please stay with us because we'll after we've had a bit of a chat with Dennis, we'll then come back to both of you for any questions that people have. And just a
I,
reminder to everybody, do pop
Thanks.
questions.
Sorry, Jess. I was going to say I'll turn my camera off and I'll catch up with the messages because I see there was a lot of gratitude in there. So I'll say thank you to everybody now, and I'm going to turn the camera off. But thanks, Jess, and good luck, Dennis.
Thank you. And just a reminder to anybody, please do feel free to pop questions for David and Dennis in the chat, and we'll be coming to them shortly as well. We won't be able to come. I think I've just seen someone's raised their hand. We won't be able to come to people verbally, but do feel free to pop questions in the Q&A. But you can also contact the team on a chat as well if you select panel. Okay. Dennis, hi.
Hi, how are you, Jess?
Hi, Dennis. Good to see you. Thank you for joining us. I guess before we get started with some questions, do you want to just then tell people a little bit about yourself, introduce yourself a little bit?
Yeah, sure. I'm Dennis Baldwin. I'm based up in Salford. As just I don't know if you can hear me properly. As just mentioned, I'm the project manager in Start Inspiring Minds, which is a therapeutic creative arts organisation that supports people through their recovery journeys from mental ill health. As part of that, I look after Reach Out, Start to End Suicide, which is a community-based mental health program, suicide prevention program that's run locally, and all our interventions are local interventions as well.
Thank you, Dennis. And linked to that, I wondered if you can tell us a bit about the programs of work that you use to challenge
Mhm.
stigma around suicide at Start Inspiring Minds.
Yeah, just before I start, I'll touch on the fact that my living experience is based as a suicide attempt survivor. I've made multiple attempts on my life. And so basically, my experiences are very much at the heart of Reach Out, Start to End Suicide, which I think by having that living experience actually sort of furthers the impact of it. And I think it's that understanding that's given it quite a firm grounding in Salford, which is fantastic, the support that we have received. As part of my mental ill health as well, sometimes I have issues with my short-term memory. And they can't tell me if it's my mental illness, which is anxiety and depression, or if it's the medication I'm on. So I will be referring to some notes as we go through as well, but I'll interchange that with some stories too. I'm much better at Q&As than I am. So what I'll do is I'll go through this and then we can get on to the Q&A that hopefully you'll all enjoy. So basically, I'll give you a little bit of a backstory to Reach Out, Start to End Suicide. It came about 7 years ago now. Reach Out, Start Inspiring Minds was celebrating its 25th anniversary. And as part of that, they came to me and they wanted me to actually take control of the celebrations, if you like. That's where the concept came up, using my lived experiences. I put to them about, rather than a celebration, how about we do something with a bit of legacy? Sadly, we had lost some volunteers as well as some members to suicide, and it was a great starting point for us. And from there, it's just grown year on year on year, which is fantastic for us. But Reach Out, Start to End Suicide focuses on raising awareness and fostering community engagement to prevent suicides. By addressing the language of stigma in various ways, it helps us to normalise conversations about suicide and mental ill health. By us creating these platforms for open dialogue, this program of work encourages people to discuss suicide without fear or shame. The project uses living experience, campaigns and public events that remove the harmful associations and the silence around suicide, helping people understand that suicidal thoughts are a mental health issue and not a moral failure. Instead of focusing on suicide through the lens of judgment or clinical detachment, Reach Out, Start to End Suicide highlights the human stories behind suicide, so emphasising the challenges and vulnerabilities faced by those at risk, but those that are surviving through their mental ill health and their recoveries from suicide attempts, as well as experiencing suicidal thoughts, as well as bereavement as well. By promoting through outreach, this program encourages people to offer support rather than blame or distance, shifting language from terms of weakness or selfishness to empathy and understanding. The first session here, we've got the wonderful Heather, who hopefully will be sharing some pictures in the chat. If you could share the first one, which is a flyer for Surviving Suicide Peer Support Art Group for Attempt Survivors. It's an art-based peer support group for suicide attempt survivors, people who have or are experiencing suicidal thoughts and ideation. It offers a creative and therapeutic outlet for the participants. It challenges the stigma through art that allows people to express complex emotions that may be difficult to put into words. It also provides an alternative to traditional conversations that might carry stigma, and offers a safe space for reflection and healing. Through art, attempt survivors can reclaim their stories, emphasising survival and resilience and personal growth, rather than solely focusing on the suicide attempt itself. So it changes the language from one of failure to one of recovery. Peer support also helps the individuals understand that they're not alone in their struggles. The group fosters a sense of shared experience using language that emphasises understanding and solidarity rather than isolation and alienation. In the past, we've run this group and we've seen the mental health and well-being on average increase by 110%, which was actually quite astounding. And we actually made 3 interventions that saved someone's life that was at that point of making an attempt on their own life. Sadly, this group was actually set up. Well, I set it up because I was hearing stories of people that feared talking about their mental ill health, or not even their mental ill health, their suicide attempts, or their suicidal thoughts. And it was fear of judgment because they were hearing things that were coming through from other participants or other service users that were quite stigmatizing to them. And also sometimes the discomfort and could be sensed through staff members that were providing those services as well. So basically, we wanted to really create this as a safe space for them. Now, when we run the group, we don't sit there all the time talking about our suicide attempts. That's why we provide the arts there as well. It's just being in a safe space with other people that have been through similar experiences, and they can understand and share their experiences as well, and also, offer each other advice on what's worked for them. Whether or not they might be experiencing some issues around, the benefit system or local government and housing benefits and those type of things. So it's everyday types of things, but it's also that if people need that extra support, we can provide that to them as well. We also run an annual World Suicide Prevention Day vigil and procession of remembrance. What I wanted to do was set something up because I know how triggering it can be, World Suicide Prevention Day, for people that have lost loved ones to suicide. So what we wanted to do was create a safe space for people to come together. And from there as well, I didn't want people being casual observers. I wanted them to feel part of it. So by sort of taking part in the procession, which sees people, the loved ones that have been left behind through suicide, carrying flags representing, a life lost in suicide. This year it was 144, and that was like a 5-year span. The last 5 years, suicides that we've had in Salford. And it's about these family members carrying these flags in remembrance of their loved ones as well. I remember, it must have been last year or the year before, I had a grandmother which came up to me at the end and she said, I feel 10 foot tall as soon as I step foot onto that road carrying that flag. And to me, that's that if it's just that one person, I've made that difference in someone's life, which is wonderful for us. The annual vigil and procession honours the lives lost to suicide, and it challenges stigma in several ways. The procession creates a solemn yet supportive space where those we've lost to suicide are remembered with dignity and respect rather than shame and avoidance. As this is another experience we have as a society, we're not equipped. We don't deal with death under the best of circumstances, for want of a better phrase, when someone dies. But when it's by that added element of by suicide, we don't know what to do. We don't know what to say. So what we do is we just withdraw from that person that is in amongst the grief of losing a loved one to suicide. So that person then becomes increasingly isolated in their grief. And as we do that, we sadly place that person at higher risk of suicide themselves. So it then becomes this sort of spiral, this spiraling effect. So what we try to do with the procession is shift the language around suicide from that condemnation or taboo to remembrance and compassion. By holding a public event, the vigil breaks the silence around suicide as well. Rather than keeping it a private or hidden issue, the community openly mourns together and honours those lost, confronting the stigma head on. It's also about reaching out to those people that are dealing their grief in isolation, letting them know that they're not alone, that there are other people that they can reach out to. And I suppose that's where we look to the media to let people know and publicise our event, hopefully letting people know that, they aren't alone in that grief either. And as I said, it focuses on that collective mourning, healing, and remembrance, which promotes a language of care and empathy. Shifts the narrative from seeing suicide as a selfish or shameful act to one of communal responsibility and support for those that are affected. Sadly, there was a woman that we had banners out the front promoting the Samaritans Helpline, and just letting people know that, you know, suicide wasn't their only option and they could reach out for support. A woman who was just passing, she popped in with her husband, and she was telling me the story of their experience. They were living in a cul-de-sac at the time, and one of their neighbours took his own life. Um, all the neighbours came together trying to get into his house, trying to resuscitate him, you know, getting him to the hospital, getting the ambulance there and everything. So it was an incredibly traumatic experience for them. But the family, through that sense of shame, sort of discounted them from the final funeral and even the resting place for their friend and their neighbour. So it was incredibly traumatic for those that were left behind. So they also used this as a de facto, our vigil and procession as a de facto funeral for that grieving process, because we know how important funerals are in terms of that final goodbye, saying your goodbyes to people. And when that's taken away from you, it can actually add to that trauma. And so, you know, we will be able to play that role as well. But it's that stigma that people still face in that grief, that they feel that they will be judged negatively. And it is such a shame.
Thank you, Dennis. That's, I mean, I'm just also conscious that last part that you shared, very powerful. So, you know, very
Yeah,
right word, upsetting as well. I just want to remind people as well around, you know, the numbers and things that Heather popped in a chat earlier. But I think there is something really powerful in that kind of alternative that space for people to be able to come together. And I can see some comments in the chat as well about, you know, the loneliness of that grief and how powerful this is.
well, that's it. And sorry, I was just going to say as well about it's about remembering that person as well, giving them space to remember the person. Because sadly, as well, there's that stigmatizing attitude from that as we move on as a society, that person will then go so and so that died by suicide, and sometimes the language isn't even as sort of emotionally supportive as that. So it's about remembering the person beyond how they died, and it's about giving them this people time to just get together and say their name. Which is also one of the stigmatizing attitudes, is about, you know, sort of being able to say that person's name after they have died, and humanizing them, remembering them as a three-dimensional person, someone had a personality that also, you know, gave you good memories, not sort of focusing on how they died, which tragically can happen and further stigmatize you know, how they did pass away as well.
That's really powerful, Dennis. Thank you for sharing that. And I think that there's some overlap with some of the things David was talking about as well, around that humanity and the compassionate conversation, and, you know, thinking about the impact of shame and how to turn, I guess, how we need to be shifting that narrative, and language being an important part of that.
Sure.
And Dennis, I wondered, what I guess thinking about everything you shared, you've already been sort of drawing on this as well. But what do you think are sort of the main components of a helpful conversation and helpful language around suicide?
Well, I mean, that sort of leads me in perfectly to our community, our latest community engagement campaign that we're running, and it's called Everyday Mental Health Hero. And basically what it is, it's about sort of promoting those conversations in the community. And it's a 3-stage model. And it's about taking a pledge. I've got the flyer here. just read the pledge out to you. It's to be here to hear you when you need me, and I will reach out when I am or when I notice others struggling. So what we're trying to do is, while we're still sort of mentally healthy, when we're in a good place, that we can make this commitment. It's putting it out there, hopefully, where people can follow through on that commitment if they do find themselves in a place where they're struggling with their mental ill health. And then from there, what we do is we get them to take the Zero Suicides Alliance 20-minute online training. And then from there, we'll get them to wear the badge. I don't know if you'll be able to see this, but it's a Here to Hear badge. Can you see that?
I can see it.
Just,
Yeah, I can
yeah.
see it. Yeah.
Yeah, so we're getting people to wear those badges, and it's about just sort of promoting that, there are advocates in the community, and we can actually start those conversations. And it also recognises and celebrates the individuals who contribute to mental health advocacy and support on a daily basis. It does challenge the stigma by getting people talking, empowering them to start conversations and to use the word suicide. Sadly, a lot of people haven't used the word suicide. And I suppose it's one of the sayings I always say: people, well, nobody dies by saying the word suicide. It's when we don't, someone is more than likely to take their own life. So it's about moving beyond that stigma of those conversations as well. If we say no matter, and also if we say something, no matter how flippant, that stigmatises suicide, we inhibit people from reaching out to us from that point onwards. So if we say that in earshot of someone, in one of our friends, we can actually diminish their accessibility to you in times of crisis as well. So we need to regulate ourselves so we don't continue to stigmatise that language as well, and inhibit people from reaching out to us. Because sadly, it's one of those flippant remarks could actually sort of deter someone from reaching out to you. The language of mental health as well is often overshadowed by crisis as negative outcomes. This initiative flips the narrative on focusing on everyday heroes who make a positive difference, proving that anyone can be a mental health advocate as well. By celebrating mental health heroes, the project encourages individuals to take pride in their mental health journeys, combating the stigma that often accompanies mental illness or suicidal ideation or suicidality. The language around mental health shifts from victim or sufferer to hero or survivor, changing the perceptions. People recognised as everyday heroes become role models for others, promoting language that reflects resilience, recovery, and proactive support rather than helplessness. The overall impact on language of stigma, together all these initiatives contribute to reshaping that language around suicide and mental health. And it's by normalising discussions. So by us providing spaces and platforms where people can openly talk about suicide, it gives us the opportunity to challenge the stigma that silence perpetuates as well. So it's providing that space and doing away, because if we look at silence as a stigma in its own right as well, and reframing the narrative that by shifting the focus from blame or shame to empathy, support and resilience, we can change the way that suicide and mental health are discussed in the communities. Sadly as well, I'm just touching on, there's a hierarchy of understanding in our communities about suicide as well. In terms of, maybe we look at a sports person that had to retire early through injury, there's sort of a more of an understanding about why they might try to take their own life, as opposed to any of us mortals in the real world. So there's that hierarchy that exists as well, that can also inhibit people from reaching out. It's also about empowering advocates where, through peer support, recognition of mental health heroes, or community remembrance, these initiatives empower those affected by suicide and mental health struggles to reclaim the stories and change the conversation. In all these efforts, the language surrounding mental health becomes more inclusive, compassionate, and human-centred, rather than reducing the stigma, that so often prevents individuals from seeking help or discussing their experiences openly. There's one quote that I've found as well. It's from Sally Spencer Thomas, PhD, and she's a premier psychologist working in suicide prevention. And she talks about the litmus test for talking about suicide. And she says, if we substitute the word cancer for the word suicide to see if the sentence makes sense, or if it has negative connotations, we wouldn't say committed cancer or successful cancer. We would simply say cancer death or died by cancer. Thus, when it comes to suicide, we should say suicide death or died by suicide. So, I mean, that's a great little tool to use if you're ever in doubt about the language that you're using as well.
Thank you, Dennis. Thank you. I think that last part's really powerful, actually, a really powerful way of helping us reframe sometimes.
Yeah.
Dennis, are we okay to come to our final question for this part? Because I'm conscious that there's some questions in a Q&A as well. Is that okay?
Yeah, sure, no worries. Yeah, that's fine.
Thank you. And I just say I think it's really powerful. I mean, the ways that the work you're doing at Start Inspiring Minds, for ways that is really focusing on the humanity. So it's so important, and I think that's a running theme around language and stigma, is not dehumanizing people, people as people, and I think that's really really important. Thank you. Okay, so I guess the last question, a brief question, is what is one change in language you think could make a real difference in reducing stigma? So if there's one change that you can briefly describe, and that would be great.
Well, that's it. And I suppose it's touching on what you said, and it's not losing sight that we're all people. We're all susceptible to frailties, and it's it's understanding that sort of 1 in 5 of us are going to have suicidal thoughts at some stage. And it's like 1 in 15 of us will actually go on to make an attempt. So when we look at those type of statistics, we should be able to talk about it in a fearless way. But again, I suppose we've still got so far to go. But just if we can keep sight of, the individuals, and hopefully if we can start conversations at the earliest that we can, we'll be able to save more lives being lost. But again, it is a community responsibility, and we can't do it alone. We need to do it. And I thank everyone for coming today for that, and their contributions to doing away with the stigma that inhibits people from reaching out. So thank you everyone for that, and thank you for listening to me.
Thank you, Dennis. Thank you. I think that was so powerful to hear. And I don't know if you get a chance, do have a look at the chat. We'll also make sure we can send you the chat as well, because people have made quite a lot of comments about how powerful and helpful your reflections have been as well. And just to highlight as well, comment around terminology around living experience, which I know a lot of people find really, really powerful as well. So
yeah,
thank you, Dennis. And I can see we have David back as well. So both Dennis and David, or two Ds, here together. And if people have questions, do feel free to pop them in the Q&A, and we will get through what we can get through. I am going to come on to actually the first question in the Q&A, if that's okay. If that's okay with you both. So the question is, it's from an anonymous person, but it says, thank you so much for this session. Many organisations often run public awareness campaigns around World Suicide Prevention Day and World Mental Health Day, which we touched upon earlier. what is the best language that we can be using to help support people to make these campaigns truly meaningful and helpful? So I'll give you a minute to think as well.
Oh, one word answer, compassionate.
Sorry, David?
Well, I'd say one word answer, compassionate. It comes back to that compassionate language. I mean, the dictionary is full of words, and it's our choice which ones we choose to use. So again, it's about being mindful of the subject. It's not just about suicide. Obviously, I'm speaking about the criminal justice system as well. And the labels and terminology that we use. We want it to be helpful, not unhelpful. We want it to inspire people to contact us or to make that call or to ask that question, not to carry on with the stigma and discrimination.
Absolutely. Thank you, David. I feel like it really goes back to the points we're saying about that compassionate human conversation. Yeah.
I think the first thing I'd say, and it's always about public awareness, it takes more than a day to sort of filter through and work. It takes a lot of time and a lot of effort to develop these. So it might be great to launch them on those days, but I can continue the messaging for as long as it takes to get those messages through. And as you say, it's about using language that is accessible to people. And I suppose I saw some comments about the Roma gypsy community as well, and it's understanding those nuances within communities and how they view mental health and suicide, and utilizing those channels to make the most of that messaging as well. Because language can be a barrier. And that's don't be ethnocentric about everything that we do and say. It's about sort of having a broader understanding, and I think it's also the point that you should be using living experience within anything that you develop like this. I know co-production is a big word of the day at the moment, but it is about that co-producing of campaigns, to ensure that both people that are living with suicidality and those that have lost loved ones to suicide can come together and make it an incredibly meaningful, powerful tool to use as well.
If I can, just quickly as well, Jess, something that I'm also a member of the Samaritans Lived Experience panel, and we're involved in the terminology they use, in the kind of imagery they use, locations they use. So it's going back to what Dennis' point was making, the point Dennis was making there about co-production. Co-production is so important. It's like having user research at your hands, if you like.
Yeah, absolutely. Absolutely. And there's something I think you can really tell when language has involved people with living or lived experience in campaigns, I would say as well. Yeah, absolutely. Thank you both. And I had a question, so please do keep your questions coming as well in the Q&A, everybody. I know that there are some, I just wanted to highlight as well, I think Rosie might have put this in the chat, but there's been lots of conversation going on in the chat, so thank you all for that as well. We haven't included all of those, I think some of those are comments rather than questions, but we are going to save the chat and go back to it, because I think there's so much richness in that conversation, and think about how we can maybe come back for some more interactive conversations, because it sounds like people have got a lot of reflections who have joined today, so thank you. I guess I had a question that actually came up before. So one of the questions that some of the questions people submitted before this webinar, and I'm not saying it word for word, I'm kind of merging a few similar questions together with this one. But I guess it's a bit about the nuance. For David and Dennis, who know me, I love a bit of nuance. I think things are, there's a lot of grey areas sometimes as well. And I guess, and one question we were sort of asked is, there may be some types of language and some words that different people have different views on, even, people with lived or living experience as well. you know, some people might interpret the word commit differently, for example, but I think that that's one that's, you know, the general guidance is that we shouldn't be using the word commit. But there are other, you know, other types of language where some people say, oh, I really like this, or I really don't like that, and there's differences. And I guess the question would be how, you know, how do you think we can navigate that nuance around different perspectives and views of what language is and isn't helpful?
I suppose in terms of language, it's very difficult sometimes to sort of be regimented with it. I'm always a firm believer in, you know, it's the context within how that conversation is being held. We don't know what the intent from that person is. Will it stifle them from reaching out? You know, it's all this language is ingrained with us. You know what I mean? It's like they don't want us to go to A&E anymore. But from children, you know, we're being told if it's serious, go to A&E. And of course, we're going to do that with our mental illness as well. But now there's a real push away from that to happen. And it's going to be very difficult. And it's going to take, I think, generations for that change to happen about uh, what is appropriate crisis support for a person and where should they be. But it's also that with that nuance around meaning behind things. I'm always a firm believer if they're going to talk about it, they'll use that language. You know, hopefully it'll start there. And it's also, you know, maybe even just modeling your language, I think can be an incredibly powerful way. Because I've been talking to people and, you know, they'll start saying committed suicide, and then I'll say lost by suicide, or, you know, took their own life. And then they'll even apologise mid-sentence and say, "Oh, sorry, I didn't know the language" themselves. So I think about it. It is about that modelling as well, which is, you know, because as I know in the community, a lot of the time suicide is it's the first time someone's actually said the word.
Yeah.
So to get them to talk about it, it's an incredibly powerful tool. So we don't want to stifle that. So it's very. You know, and it's just all we can do is model the best advice that we're given, which, you know, I always make reference back to that, as David was talking about, the Samaritans, very good on that. I mean, I don't know sometimes why certain terminology is better than others, but I'll just, again, I've always been a firm believer in saying I'm a multiple suicide attempt survivor. And I keep saying that. And I did actually have someone in a meeting thank me for doing that, because it gave them the sense of empowerment that they could talk about themselves as an attempt survivor as well. So again, it's about that modelling of behaviours too. And it's, you know, it's my second nature now. It's made me who I am today. You know, so I need to give it that level of, you know, understanding from where I'm coming from. It doesn't define me as a full person, but, you know, it is a big part of me, and it's you know, I am in recovery. I still have moments of ideation, but I've now got a repertoire of tools that I can, you know, at my disposal that I've learned over the years. But again, I'll say it's the nuance of language. I've moved it back onto me. But yeah, so
Thank you,
maybe
Dennis.
David's got something to add to that.
Well, I kind of want to comment on what you're saying about context, and I think that's really important because obviously, if I was in a listener's call in prison and someone was using the wrong language whilst talking to me about their struggles, I'm not going to be challenging them over their language at that point. So I think context is extremely important. But from what someone mentioned or mentioned it in the chat about consistency, I suppose, where they might use died by suicide and then they use of homeless people. So although they're using language in the right at the start, towards the end of it, they're swapping back to labels again. And I see that quite often within the criminal justice system, where people post about the stigma and discrimination, and use labels to describe people. So as well as context, I think consistency in a way, and I like what Dennis was saying as well about the modelling side of things. The more that we use the right language, hopefully the more people that we're connected to will use that same language. However, that's only the people we're connected to. And just like the criminal justice system, unless you've been impacted by it, like suicide, been impacted by suicide, are you going to have an interest in that subject, or are you going to be driven or get your information by the media? So the words that the media use are going to be the words that the majority of people that haven't been impacted by suicide or the criminal justice system are going to use, because they see it on a consistent basis. And it's only when you get involved and become impacted by suicide or the criminal justice system where language seems to matter. It doesn't matter outside. It's kind of happening within this bubble. And that for me is why we need to get that awareness out further. And we can only do that with the assistance of the media. And not just the media as well. I was watching a program the other day on Barlinnie Prison, and the guy said that one of the people in prison was threatening suicide. And it really astounded me that the BBC was still using that type of language. But yeah, as I say, it's the TV that people watch, the papers that they read, the social media posts that they read, that's all going to impact on the language they use, because that's the consistent language that they see. So it really does come down to the media and TV producers and TV companies to ensure that they're using the right language.
Absolutely, thank you, David. And there was a question earlier, actually, which I think Rosie's answered the person who wrote that question, but it was about media guidance as well. So it might be worth I don't know whether Heather or Juliet can pop that Samaritans media guidance in the chat. I know David, you referred to it earlier on as well, when we were talking. Thank you. That's really, and I would definitely echo what you both said about context. And there's something there about being able to have the conversation that I think particularly people who are impacted by suicide, that people then aren't so scared of using the wrong words, but then they don't talk about it at all. So there's that balance, isn't there? And I really like what you both said about that kind of, yeah, that role modeling with it, and then influencing those who have a wider reach as well. Thank you. Okay. I guess another question that's come up in the in the Q&A is from an anonymous person. It says a lot of people worry about planting the idea of suicide in someone's head by talking about it. How can we reassure people it's okay to talk about suicide and suicidal thoughts? I'm
aware of that myself, but there's no evidence to back that up. That talking about suicide means it's more likely. And funny enough, that's something we got trained in as listeners. We had to ask the question, and that was one thing that they did in the sifting process, to make sure that you were comfortable talking about suicide and that you were able to ask that question, because the likelihood is, by mentioning and talking about suicide, someone would be less likely to go off and take their own life than more so. Yeah.
Thanks, David. Thank you. Dennis, do you have any thoughts on that?
Sorry, what was the question again? The short-term memory's not the best. What was the question again?
It was a lot of people worry about planting the idea of suicide by talking about it. How can we reassure people it's okay to talk about suicide and suicidal thoughts?
Well, that's it, and I think it is a myth. I mean, that's, it's a well-founded myth, that, that type of thing, and it perpetuates that stigmatizing of what it is to talk about suicide. And I think also, because we're touching on the media there, because I know that there's this real sense at the moment to put warnings about suicidal content in things, which I think in some respects can actually start stigmatising suicide even further, because we start putting censorship warnings on things, we will then sort of go, oh, it's bad, I can't talk about it. So it's reinforcing that, rather than sort of, you know, leaving it up to people to be intelligent enough to understand what the show is, you know, have a look at the information if they are sensitive to those type of things. But again, I suppose it is language sometimes can be triggering. I know there's a term that's growing in popularity, and that's cliff edge, in a lot of admin setting meetings, where it's, oh, we're at a cliff edge with this particular work program or whatever. No, you're not. You're not at a cliff edge. You know, why describe it in such a way and a means that could be triggering for someone? You know, it's in terms of, we start then sort of associating with suicidality and what people might be experiencing at that time in their lives. And it is things like that that we start to accept into our vocabulary and start repeating, because, you know, it is that modelling again, isn't it? We see senior managers start modelling these languages, then going to trickle down through organisations, and it's not helpful at times. So sometimes it is very difficult to get the people at the top to start using language that is appropriate. And, you know, it's that power dynamic. How do you approach someone in quite senior position about it? But I suppose we need to learn in ourselves to go, well, no, you're doing that wrong. And again, I suppose stigma's quite a powerful label to have as well. Because if you say that's stigmatising people, no, it's not. It can't be. You know, that type of thing. No, I know what stigma is. That's going out and beating someone up. And it's like, no, it's all these elements that go through, sort of that unfounded understanding that you know, you're perpetuating these type of myths throughout life. And I suppose it's us going back and untangling all that to then sort of go on and retrain people through. But again, you know, having so many people here today, hopefully, that are understanding of these, you know, it's that network, that ripple effect, you know, because I've been to hospitals where we do assertive outreach, where we go and talk to people. A couple of years back, it was NHS workers after the pandemic. So we go and give them free pizza, and while they're eating their pizza away, they can't answer back to you, so you have full conversation about suicide prevention. But there is something quite powerful about that communal eating as well that makes people receptive to conversations. We also did the same thing with builders, and people would go, oh, men, they'll never reach out. But it's providing that context. And I think through hearing my lived experience about it and giving them that safe space that they could talk about it, they were incredibly receptive to it. So I think it is about that sort of, you know, doing away with generalisations, as we're talking about that sort of, you know, ex-criminal and all those type of things. It's about unraveling all that preconceived ideas that we have, and it's you know, there's still a long way to go, but it's small steps. So every day's a learning day, hopefully, for everyone.
Thank you, Dennis. Thank you. There's a question on the Q&A, which we've also been asked a few kind of similar questions in advance. So this question is, my understanding is that attempted suicide but didn't complete is not acceptable, and what is recommended. We had other questions about, you know, is this phrase better than that phrase? Rather than going into each individual phrase, because I think that there could be quite a lot of nuance. I just wondered if you have any thoughts about, I guess, as language changes, like, so for example, this question, my understanding is that attempted but didn't complete suicide is not acceptable. What's the alternative recommended? If you had any thoughts about language that you find is, you know, is okay and not stigmatizing, you know, when describing, say, somebody who'd made a suicide attempt or somebody who'd died by suicide. I've got a few thoughts as well I can add to, but I just wanted to see.
Yeah, I mean, I've always found an attempt survivor, and I've found the word survivor quite empowering to myself. But again, going back to quoting that academic about the litmus test, about sort of, substitute cancer for suicide. And I think that's quite a powerful test as well, to see if there are any negative connotations behind it. But I'm a firm believer. And I also love living experience, because we're not compartmentalizing and saying, well, that's when I was, I'm sorry, it's not in the past tense, still happens for me. I don't think I'll ever be rid of suicide now. It's sort of got its hold on me, but I know how to control that beast. I know how to keep it at bay. And I know when it gets too much for me and how to reach out. But it's about finding that language and listening to those around you with the experience of it. They're the ones that are going to give you the true litmus test.
Yeah, absolutely. Because I guess, people will have different views of how they would want to describe their experiences. So some people wouldn't like to use the word survivor, but they would still want to talk about, I've attempted suicide or something. So it's asking people how they would, what language they would prefer to use to describe their own experiences. Yeah. David, what do you have any thoughts on that?
Yeah, I mean, I like what's being said in the chat, non-fatal attempt, but one thing that we have to get away from is unsuccessful attempts. That's most definite. And I think as well, we sort of discuss suicide as if it's a dirty word that should be spoken about in dark corners, when it's not. It's not a dirty word whatsoever. And I think, again, people that are in this bubble, if you like, for want of a better phrase, understand that suicide isn't a dirty word, and it's the wider public, the wider kind of society that need to understand that suicide isn't a dirty word, because it isn't. It's as simple as that. But yeah, I mean, there are many ways that we can describe many situations in life, and there's ways that we should do it and ways that we shouldn't do it. As I say, unsuccessful being one of those. But I do like not the right word, I suppose, but non-fatal seems quite an accepted term to be using. But then attempted suicide, I mean, if it's not someone taking their own life, I think it's implied that they didn't. It didn't go through. I can think of the right thing to say there. And again, that's the thing, isn't it? We're not always 100%. I mean, I get it wrong sometimes. I've noticed that I've said committed, probably because I've tried thinking about, right, don't say committed, and I end up saying committed suicide. So yeah, I mean, I think the thing is there not to beat myself up, or not to beat yourself up about it. And either change yourself there and then, and apologise for using it, or just carry on talking as if sort of it didn't happen, hopefully. But as I say, no, you don't get it right all of the time. But it's about getting it right 99% of the time.
Thank you. Thank you both. And I guess that goes back to, I think, a point that was made earlier, which is around, intention. Intention can be really important as well. I'm just looking at some of the questions. So we've got a few more questions that have been submitted. We've only got a few minutes got about 5 minutes before we wrap up. So I'm just having a quick look at those ones. Oh,
while you're doing that, you have a look for the next question. I was just going to mention as well that in A&Es, or within the NHS itself, there's no classification for suicide or suicide attempt survivors. They all generally come classed under self-harm, which we know can be two totally separate sets of circumstances. Sometimes there is a level of overlap with that, but until we can get an understanding of how many attempt survivors there are, so how many non-fatal suicide attempts there have been within the confines, then we're going to have a better understanding, because we've seen an increase in suicides of women, But do we know if the attempt ratio is matching
Yeah.
that, or is it just about the means that you're
Yeah.
using?
Yeah.
So it's we need a better, fuller picture. And again, I suppose we could classify that under stigmatising suicide. They don't even
Yeah.
want to talk about it in A&E. So what hope have
Yeah.
we got? Yeah.
Yeah. So, thank you,
So
Dennis. I think thank you. I can see so there's quite a few questions that have come up, which we won't get time to ask about all of them. But I will just so I'm going to come on to one of them that's been waiting for a little while, and it's so I think this is something it's okay if you don't. Please don't feel that you have to answer this one, Dennis or David. But if you've got views on it, you're very welcome to. Um, and it's, do you think that some people are reluctant to talk about suicidal thoughts out of fear about what might happen? So, for example, they might be fearful about being sectioned or about social services involvement, etc.
From my experience within the criminal justice system, within prisons, yeah, very much so. There's a lot of there's a lot of things that people will not disclose
Mm,
through their fear of authority because
mm,
of the way they've been treated by authority over the years. There's a very mistrust is massive within the criminal justice system, and probably a reason why the criminal justice system is as bad as it is because of that mistrust. If people could trust the authorities, if you like, within the criminal justice system, then hopefully there'd be more chance of them engaging. But
mm,
unfortunately, that mistrust, and again, that comes down to the view of the authorities of people like I was, and the way that they used terminology to describe us. Um, I mean, they're kind of millimeters away from calling us scum. Do you know what I mean? So when you view yourself in that way and you get treated in that way by the system, you're not going to trust that system.
yeah, yeah, absolutely. Um, and there's something I just want to highlight because there was a question that came through before this webinar, which was around kind of language, and actually, are there some things that are bigger than language, which is around, some of the in causing stigma, and I think there's something around the criminalization and the power relationships. But as you're talking about there, David, about then mistrust, which is wider than language as well.
Well, and you've got the draconian sentences, the indeterminate sentences for the public protection,
Mm,
where people are serving way, way over their tariffs now.
mm,
It was something that was taken off the books in 2012, introduced in 2004 by Labour, and has just ruined so many lives, absolutely ruined lives. Since its introduction, 85 people have taken their own lives
mm,
because of that lack of hope. But if you're in someone in that situation, I've never had the experience of that or being a lifer where the things you say can see you being recalled back to prison for the next 5 years. And
yeah.
talking about suicide and things like that, it's a very precarious situation for someone in that
Mm,
situation.
yeah.
I can speak from heard experience and the people I've spoken to in prison, but I can't speak from lived or living experience.
Thank you, David. Thank you. And Dennis, but I'm conscious that we need to start wrapping up now, but I wondered if you had any thoughts about that question. So around um sorry, the question's disappeared, but the question around th- uh, the
about
fear of
the
fear
stigma.
of
Not
Yeah,
talking
stigma
about
sort of
it.
impacts. Yeah.
that's it. I mean, it's just that trust, and it's you could actually sort of intertwine that for people that live with drug and alcohol issues,
Mm,
and it's gambling issues. It's all these issues that
mm,
fear of what could happen, whether that be marriage breakdown, access to your children, it's all these type of things. And again, I suppose we could even start looking at, for inpatient services. You look at some of the treatment that's been going on, especially at Prestwich Hospital as part of Greater Manchester Mental Health, in terms of the way that the inpatients were being treated. So anyone with a mental illness would not want to be sort of put in a position where the abuse that they receive was quite archaic and shocking. So it's a broad spectrum of what
Yeah.
people do, and I suppose it's looking at things like, the rape crisis services and things like that. How many convictions are being upheld. So why would you report it if there's only such a low percentage of it? So it's right across a
Yeah.
broad spectrum of issues. It's not
Yeah.
just around suicide and
Yeah.
that fear of judgment,
Yeah.
but it's very much across a lot of areas.
Yeah.
But in terms of what we're doing here today, it's around
Yeah.
suicide. So there is a definite fear of being judged on that.
Thank you, Dennis. Thank you. And I think there's a lot of, and some people have spoken to this in the chat as well, some of the intersections, thinking about, experiences of domestic violence, social services, of being silenced. So I think that was really, really powerful, and important. I think important for us to remember that this is wider than the words itself,
Mm,
but how, how much freedom we have to use our words and as
mm,
well. So thank you. Okay, so that was the last question because I think it's important that we can wrap up because I know I said we'd finish at 11:30. So I just wanted to give a bit of a summary of some of the things we talked about. I won't be able to cover everything because we've talked about quite a lot, haven't we? And I'm also conscious that a lot has been spoken about in the chat. Sorry, I haven't been able to come to the chat a lot. My ability to multitask, and I wanted to make sure I was really present with David and Dennis. Um, oh, can we just pause for poll for a second? Sorry, I think a poll's just come up, but I'll come on to that in a second. But just to say, there's so much. Thank you all so much for your conversations as well, for listening. We are going to look back at what was discussed in the chat and think about how we might be able to come back to this conversation because it's really clear that a lot of people have things that they want to talk about and say. So thank you. I also really want to say, emphasize about the nuance. So there's been some things people said about, oh, I like this language and I don't like that language. And some people find it some words stigmatizing and some people don't. And I think it's really important that we kind of lean into that as well, lean into the fact that different people will have different preferences around what they find stigmatizing and what they don't, and that there's a nuance there as well. So I think it's important that we can we can come back to that and keep exploring that as well. I would just like to say thank you so much, David and Dennis. Thank you so much for sharing, and for such an insightful conversation. I've certainly learned a lot from this conversation.